long-term stability of the organization. So many people don't understand the cost. I certainly didn't until I came into this organization with my family. The cost that goes into health insurance, any employee benefit plan from an employer perspective. I wish that, you know, I could stand up on a soapbox and show everybody all the numbers so they truly could appreciate what employers do and the position, unfortunately, that our government has put a lot of organizations in the employee benefit space. So I was tasked with going out and finding a major medical option that was affordable for the employees and that is affordable for Kemper House, okay? And I was able to do that through a TPA that we work with. A TPA is called a third-party administrator. To you guys, it will look and feel exactly like Anthem, United Healthcare, Aetna, Cigna, any of those major medical insurance plans that you've either been on or heard of. So how that would be different, redirected there, which I know many of you have now, is this is major medical insurance. This is standard deductibles. This is a network of physicians and facilities. This is co-pays for things like doctor's visits, you know, x-rays, certain services, all of these things that are more traditional. Okay, Redirect and Sedera is a very good platform. We all know that it's different. I think many people who have used it understand that it is different. That is the way that the insurance world is going. But these major medical plans can still provide a lot of value for things like I just said. You know, if going to the doctor and paying your copay is important to you, then a major medical plan is really the best option. So also things like prescription drugs, right? Like we go to the pharmacy, we pay our $5 for our generic prescription, and we're on our way. Now, the caveat to this is in the state of Ohio, everybody knows in healthcare reform, Obamacare, whatever you want to call it, everybody knows that they eliminated, you know, pre-existing conditions. But what a lot of people don't know is that you still are allowed to do something called medical underwriting if the plan is self-funded. Self-funded plans mean the employer is paying the claims. Okay? So we won't go into the background of all of that, but the main reason I'm here today, that's the front end of the story, is to talk to you guys about the medical underwriting process. It's through a software that we use and pay for our clients, like Kemper House. You log into FormFire, it's a secure online software, and you're going to be asked to fill out a health questionnaire. Okay, so then once we have all of the health questionnaires for anybody who's considering this as an option, I'm going to take it to the TPA that agreed to do this. They're going to evaluate the risk on all of the combined health questionnaires, and then they're going to give me numbers for this plan. Okay, there's no way around this. If you want to be considered on this plan, you have to do the health questionnaire. There's no way around it. You can't say, oh, I think that's illegal. It's not illegal. There's a loophole in the law. That's why we've done it 200 times in the last 5 years. So if you want to be included in this option, if you want to evaluate it, we got to do the health questionnaire. Okay. So I've sent Denise and Greg instructions that are specific to Kemper House on how to get this done. Okay. We would like to try to get it done in like 2 weeks. So by the 1st of October, I brought more cards for Stacy George, who's your guys' account manager. I know a lot of you probably have talked to Stacy over the last year and a half, however long it's been. She can help you. I can help you. If you have trouble on the website filling out the questionnaire, we can log in from the admin side and help you through some of the questions. So it's going to ask you things like, it's very broad, and the reason it's very broad is because we can take that information and we can put it on any insurance form. There's thousands of insurance carriers in the United States. Instead of asking you guys to fill out, you know, 5 questionnaires, we can have you fill out 1, and then the software auto-populates onto all of the carrier's forms. So that's why we have you do it, but that's also why the questions, when you guys see them, and Greg and Bob, Chelsea, some of them have already done this, you'll notice that the questions are very broad. It's like, in your life, have you ever had, and then it lists 100 things. And if you're over the age of 20, like most people in this room probably are, you have had a cold at some point in your life, right? So the way that I want you guys to think about these questions in FormFire, I want you to think of it from the insurer's perspective. So the things that they need to know about are chronic conditions, number 1. So if you have a heart condition and you see a cardiologist semi-annually, once a quarter, whatever it may be, like that needs to be on there. So when they get to the heart section, you need to say yes, right? This will make a lot more sense once you sign in and see it. If you're on any prescription drug that is prescribed by a doctor, it needs to be in there. Why? Because these are the things that are going to hit the plan, meaning the insurance carrier is going to have to pay for, so they need to know about them. Okay? Because if you say, I've never had a heart condition, and then first week that you're enrolled on this plan, you go to a cardiologist, which is a specialist, they're going to be like, whoa, whoa, whoa. Like, we just got these health apps. You said you don't, and now you're seeing a cardiologist for a chronic, congestive heart failure, just an example. Does that make sense? Does anyone have any questions about that so far?
So this new one's gonna cover specialists?
Yep, there'll be specialist copay. So if you have to go to an allergist, orthopedic surgeon, anything like that, you'll pay, can't remember what it is, I think 50. You'll pay a $50 copay, and that's it. There is a traditional network, so it'll be back to, is my doctor in network, yes or no? We're kind of going back to that versus redirect where there is no network. Urgent care copay, $50. Emergency room, there's a copay. I think it's $300 or $400. But it's going to look and feel like what most people have had in the past are used to, that sort of thing.
Could you maybe explain a little bit about like the benefits to the Sedera and the redirect healthcare as opposed to this
Major medical.
Major medical.
It's going to be less expensive, first of all.
Start over that. What's going to be less expensive?
Sorry. Redirect and Sedera is going to continue to be the less expensive option, meaning coming out of your paycheck. What's your pay frequency? Can't remember. Yeah. So what you're going to see every 14 days is going to be less with Redirect and Sedera versus the major medical plan. But again, I mean, if Redirect and Sedera, if you've tried it, you don't like it, if you're on prescription drugs, if you want to be able to go to the pharmacy and know your drugs are covered and pay your copay, then doing the major medical plan is a good option. Redirect and Sedera, good option if you just want, I don't really go to the doctor, I got no chronic health conditions, but if I end up in the hospital, I don't want a medical bankruptcy, right? That's a really good option because Sedera, in that scenario, you get in a bad car wreck driving to work, Sedera is amazing, and it's going to kick in, obviously, if you're in a really bad car wreck and get hospitalized, the claim is going to be over $1,500, and you pay your $1,500, and Sedera covers the rest. Redirect is still really strong with, if you just want to go to the doctor once a year, if you're comfortable with telemedicine, you don't want, if you're cool with, hey, I feel sick, I can do a telemedicine visit, that still is free on Redirect. So it's situation by situation, and that's the kind of thing that we can, guide you guys through those decisions. Either me, people in our office, Stacy, who's your account manager. We just want, I've been saying this since I first came here, we want you guys to make the right decision. Everybody's situation is different.
Yeah, so it's just an expanded option. Redirect, if it works for you, you will not get anything better than that. If for some reason it doesn't, and it's that 80-20 rule, maybe less than that, but if it's just not working for you, then you go to a major medical, but just know it's going to cost you more out of every paycheck. But it will be more that traditional, you go and you pay $25 for Medicaid. I'm just throwing that out there. It might be more or less or whatever, but you do a copay for medication, do a copay for a visit. It's more along the traditional line. And so this way we're sort of covering everybody. So people that have major medical issues probably would go with a major medical. Yep. And those that are really healthy and like for me, I'm Sedera and Redirect all the way. It's perfect for me. I can do telehealth. I can go see the doctor when I need to. I can go get chiropractic visits. I can go do the things that are important to me. So it works perfect. And others will see that it doesn't work for them. So, but you have that option.
So maybe I can give you guys some examples to make it more clear. If somebody walked up to me and said, I have type 2 diabetes, which one should I pick? I would say major medical plan all day, every day. Okay. If someone walked up to me and said, I have to see a specialist for my Crohn's disease and I take medicine for that, what should I do? I would say major medical plan all day, every day. Okay. Those are two common ones, right? They both require consistent follow-up specialist visits, whether endocrinology or gastroenterology, right? They usually are treated with prescription drugs, some that can be extremely expensive, like Humira, $60,000 a year. Don't know if anyone knows that. See it on the TV every day, 60 grand a year. So yeah, those are two really common examples that we see all the time. You know, and that's the reason that major medical plans are more expensive, is because the plan does pay. You know, you go get your Humira injection, it's, you know, $20 or $50 a month for you. But what you don't see is that that insurance carrier is picking up, you know, the $58,000 balance a year, right? So that's why the premiums for these plans are always going to be more expensive, is because they do include that.
And they will let us know how much it will be for this additional option. Yep. And anyone who would like to switch will have that option.
Correct.
Is that right?
Yep. So we need to get it done within 2 weeks.
October 1st to start.
Right, what we're talking about right now is if you'd like to switch to a more traditional plan, there'll be a document you'll have to fill out, which is what Jason was talking about. We can email it to you through our we can go through the account manager. You fill out that document, it'll assess everyone's sort of medical needs, and then once we have enough people there, then we can start it after they let us know.
Well, don't we have to have 10 people commit to it?
You have to have 10 to offer 2 plans, which you need to be able to offer 2 plans, 2 of the lifestyle plans.
So if you're interested, let us know. I have cards after the meeting, and then we can get you the information. You can fill out the form,
Yep.
And then this will be an option in the coming months. Soon.
Yep. I would say the earliest that it could go into effect, if everybody gets this done by October 1st, would be for November 1st.
We're going to try to see if we can get this form on Paylocity so that you may not even have to reach out to this account manager. We can get it
Well,
all.
I sent, and I'll resend it after this, that there is a letter, a PDF letter from FormFire that I thought the plan was to I send it to you guys. We can print it out and you can literally hand it to everybody.
Yeah, I can print out some and make sure that people get printed out.
Or email, however you want to distribute it.
Yeah, I'll also post it on Paylocity, so if you just want to pull it straight from Paylocity, you can do that as well.
So it's got all the instructions about how to go out to FormFire. I'm sorry, I don't know how much time I have. Am I good?
So go ahead.
Am I good? Yeah. So you're going to go out to FormFire. It's going to say, like, go out to this link, www.formfire.com. If you've never created an account, you need to go through the account creation process, which requires a code that is on that letter that I'm referencing right now that's specific to Kemper House. Once you do that, you'll log in with your personal information, and then if you do intend to be included in the pool that goes to the major medical carrier, you will have to answer the health questions. If you're not considering this, if you're like, I don't even care, I don't want to see the price, whatever, then you don't need to do this.
Jason, but just by filling out this healthcare questionnaire does not mean that you are committed to having that kind of insurance. It's just going to give us a quote to see what it would cost to have that type of insurance. So
Correct.
don't feel like you're committing yourself by filling out that.
Yeah, we're not gonna, if you do this, we're not gonna cancel Redirect and Sedera, we're not gonna do anything, right? We're gonna take the group to market, we're gonna get the numbers, come back, say, this is the rate for the group that we were able to qualify for. What is your decision? You can either switch, and if you switch, we'll kill Redirect and Sedera, right? Effective the same date that you switch to lifestyle health plans, which is the TPA,
Is it also if like more people sign up, it's gonna be cheaper for all of us?
correct? It also depends on the risk that comes back. So the health conditions, medications, everything that's in the pool.
You know what insurance company? I mean, you said a third party. Is it an Anthem? Is it a Cigna? Is it
It's a TPA. So TPA is the third party administrator. It's Medova Healthcare. Lifestyle Health Plans is the name of the plan. We have a ton of groups with them. The network that they lease is called PHCS. It's Cigna's largest national network. So, I mean, what's that?
so sort of through, say it's recognized that they recognize Cigna?
Yeah, so on your card, it'll say Lifestyle Health Plans, and then right on the front there, it'll say send claims to, and then the PHCS network
I
information
don't think so.
right there, just like an Anthem card or an Aetna card would say, you know, send claims to.
Maybe it
So right there, so you're at a doctor's office, boom, you hand them the card, it says literally crystal clear right there on the front, send claims to Cure.
And it's like actual insurance, it's not a self-paid thing.
Yes, it's actually.
Hey,
Self-paid and go to the doctor's office.
Jason,
You're having insurance.
Is there a health savings plan with that or not?
I think one of the two that we were looking at was.
Yeah, we have to get both of those in order, you know, both options. One of them does have a health savings plan, but once again,
All right, I'm gonna have to transition this for time. I hope
Thank you, Jason.
if you guys
Yeah,
are
no
not
problem.
clear, please ask more questions. What you need to take away from this is if you'd like to switch from the plan you're on now, if you're on our plan, to a different, more traditional plan, we will instruct you on how you can get in and fill out a form, give them your health history, and they'll take that to market and come back with numbers, okay?
Cool. Thank you, guys, I appreciate it.
The other thing to think about
Thanks,
is
Yep.
that the amount of money that Greg and Don give each of us for our medical benefits will not change. So they give us $150 each, and that will not change. So if you're someone who is getting $150 a month for Sedera and Redirect, you will continue to receive $150 a month towards your premium for the other. The difference is, instead of paying, you know, $1 or $2 a month or $10 a month, you'll be paying hundreds of dollars a month, $200 or $300 a month. So that's if you were going to think about that trade-off, just think about if you're on the current plan, you go and you say, oh my gosh, I just had to pay $200 for an x-ray, this isn't insurance. Well, that might be true in your mind, but think if you switch, you're going to be paying $300 or $400 a month in this new insurance plan that's more traditional, and you'll be paying that every single month. So that's the give and take you got to think about. Now, I'm not qualified to counsel you beyond that, but I do have the card people who are. So I will let you have that conversation individually if you'd like. But that's the difference, okay? I need to press on. If you guys have questions, let me know though. After the meeting, I will always be available to you know, throughout the week to talk if you guys have questions. All right, so I'm just gonna run through a few things that I need to pass on to you guys information. Remember, I don't send you guys a ton of emails throughout the week and month because I try to put it all in a box and bring it to you at a staff meeting so that you don't have to have email after email after email from your administrator saying, don't forget to do this and who's doing that. So that does mean there's a few things for me to go through, so I apologize for that. So the first thing I wanted to talk about is bad weather, stormy weather, rain and wind in our building. And the one specific thing I want to bring out is the umbrellas in our courtyards. Now, for those of you that were here a few weeks ago, you may have gotten to see someone running along the roof line of Kemper House, Worthington, in a storm to try to retrieve an umbrella. That person was Greg Sini in his suit running down the roof line. It was very entertaining, but it was not safe.
no, it wasn't safe.
It was
at all.
entertaining, but it was not safe.
No.
So please remember, if you're not using the courtyards or as you guys are going about your jobs, put those umbrellas down and close them. We don't want them left up indefinitely. So we're out there with the residents. We open the umbrellas. There's a place to sit. It's shaded. It's nice. Wonderful. But please, when you're done, or in the evenings, you know, close those umbrellas up so we don't have to run out there during a storm and close them, or even worse, have them lifted off onto the roof and have to run out on the roof to retrieve them. So just remember that if you're done and you're not out there, just close the umbrellas down and tie them up so that they stay stationary. If they're closed and secured, they really shouldn't blow away unless there's a truly, truly horrible storm. And then if that does happen, there are other issues.
Side note, Ian, real quick. There is food over here. I just don't want it to get cold while they're sitting. So
Well,
maybe like a couple at a time.
No, here's what I would say then.
Okay.
Let's take, well, I'll say it's either wait till the end or take 6 minutes, right? Take 5 minutes and do it.
I just hate for it all to get cold by the end of this.
Then let me say this, guys, happy Assisted Living Week. Thank you all for your hard work. I hope you got to see the banner in front of the building. I hope someone on the leadership team has reached out to you with some treats this week, but we also brought food this week. So let's take 5 minutes, grab something to eat, come sit back down, and I'll start up again in about 5 minutes. For those of you online, you got 5 minutes of free time. We'll see you in 5 minutes.
All right, so there is stromboli. It looks like there's a meat option and a veggie with cheese option, as well as there is salad and the delicious blackberry lemonade. So good. We're gonna get some like utensils for this though. What you gonna do? And I can change that.
Yes,
Hurry up.
a little bit, yeah.
Deb.
I can't come over. Oh, I'm here alone.
Did you attend it,
Oh, I'm happy.
Donna?
No, it's not a movie. It's a meeting. Yes.
Great
Say
pic- what
hi.
is that?
Hi. Hello.
Oh, hi, Carol. Hi.
Oh, wait, who's nurse one?
Not here.
That's one of the nurses.
Can you see me?
Oh, that's,
You
Michelle?
see your granddaughter? See
Michelle.
Chelsea?
No, where at?
She's the one wearing yellow.
Oh,
here.
when was that?
Now.
Lena.
Oh, where
Yeah,
is she?
got that.
She's at a meeting.
In
In-
Ohio?
Yes, just here.
Would it just be
How do I
Michelle
do
then?
that? This is private, is it?
Wait, no. Oh, I'm sorry. I was gonna say I did a whole bunch on
You say hello there? She don't have hers out.
Oh, she left.
Oscar with me about. I'm so pissed right now.
You see, say hi.
Hi. You know who this is?
I'm sorry I was in here. Excuse me, Hollis.
You think she hears it? Hello. What'd she say there?
We can see you.
Hey. Who's that got the tie?
She's a nurse.
Yeah, I don't know her.
Do you guys want me to have a desk to sit at? Do this?
There you go.
I got one of those.
She can see you.
We're just trying to be efficient. We're taking our 5 minute break.
She keeps it. Who's she looking at when she looks this way?
I don't know. I don't.
Here. Go to bed. You sit down.
You see a duck?
A duck?
The dog.
Oh, yes. Yes, I did.
Olive. Yes.
Now, where is
This neighborhood.
okay.
Okay. I think we can leave now, right?
Yeah.
Yes.
Hillary, I love your profile photo. Here's Lena. Are you can sit here. I'm just sitting down for a minute since I'm.
How is it?
All right, guys, about 2 more minutes, we'll get started. Again. Can you feel the difference? Just want to make sure they're all free. Yeah, but Margaret was there and she ran away. I think she was on the off, maybe she was looking for work.
Me? Oh. I was trying to social distance and then I scooted really close to Greg. Stand strong, Conrad. Thank you, Amy. Where'd she go?
They said they were starting to get for dinner. Yeah. All right, I'm gonna start winding up here again, guys, because I want to finish for time. So, I think the next topic I want to jump to is actually about COVID. I know that there has been an observation that we spent a lot of time in these meetings talking about COVID-19, about training and standards and all that kind of stuff. But you know, we have to take this seriously. A lot of people have lost their lives to this. And 75% of the deaths from COVID have occurred in skilled nursing and LTACs and assisted living type facilities like ours. So it's very important for us to take it seriously. You all know, I sent out a memo to families of you guys that we had an exposure. It's been about 10 days, I think maybe day 11, 2 weeks today. So 14 days ago, we had an exposure. We are then through or at the end of the window of when we would expect anyone to have become ill, and luckily no one has. There have been no positive cases. We've been either through our antibody testing we've done or through the antigen testing, which is still cooking, except maybe Conrad's got a little bit of a sense of it. But we are through the end of the window. We've tested all the staff that will be in the building in the next month, to the best of our knowledge, and that happened very quickly. I appreciate everyone's compliance with getting that done. So where we are today. Yes, good.
Dr. Miller advises not to test.
All right, yes. So where we are today, we are 2 weeks out from our exposure. We've added additional precautions for the building, right? So we've asked people not to mix the neighborhoods up and we're doing some other things to try to mitigate or minimize the chance that somebody could spread to the building as easily as it might otherwise. We're going to continue those till the 20th, so a couple more days just to be safe. No additional cases reported, no additional symptoms from the residents, although we are monitoring very closely. Dr. Miller our medical director feels like because we tested all the staff and we're going to hold here and then wait to test all the residents or any residents until we get our results back. If everyone's negative, if there are no symptoms, we don't have to swab them unnecessarily. We're going to hold here and wait until all of our results are back, and then we'll let you know what else we're doing. But as of now, everyone's tested, and I can at least say that no one else, we've been monitoring the residents very, very closely. The temperatures, I think we've been temperatures, I think multiple times a shift even now. We're monitoring, and we will continue to do that until we feel like we are safely past our exposure. Well past it. All right. So from the state of Ohio, fresh off the press, I haven't even told Don and Greg this stuff yet, but I'm going to at least give you guys a small report of where we're at with the state of Ohio. As of now, and if you watched the TV yesterday, you know the governor said that assisted living is going to test our staff once every 2 weeks or twice a month. That is what he has said that we are going to do. Up till now, that's not happened. There's a lot of reasons why. I don't have time to go into it all. Just to say that assisted living has not been tested by the state yet. The testing we did this week was testing we did as Kemper House. We were responsible for the cost of it. We were responsible for doing it, sending it to the lab. That was all on us. If we do, if and when the state comes to start doing testing with us, it will be a different test than we did, and it will be through a different lab, and know that all those things are possibly coming. Because we just tested, we won't have to test our staff again for 2 weeks, and that when they say testing the building, for the purposes of the state, they mean all the staff. They don't mean all the staff and the residents. That was clarified today as well. Man, there's lots of other stuff there, but for the sake of time, I'm going to push on. So a couple things to mention about indoor visits. We recognize that the weather is changing. We can't continue to visit outside for much longer before it'll be too cool to do that. There are lots of things the state is going to tell us that we need to do for this indoor visiting. No more than 2 visitors at a time. Hospice, that will continue to happen as it is now. People can receive hospice services and end-of-life visits. That won't change. The maximum amount of time people are allowed to visit is 30 minutes. Indoor visitation will be tied to the county's color level. You know that they came up with this color map so that the more dense the infection is in terms of how many people per 100,000. If our county goes to a high level, the state will stop all visitation in all facilities. So know that the visitation we do have, even when it's indoors, will be tied to the level of the county we are in. So if Franklin County goes up to purple, is purple the highest? If it goes up to purple, then we won't be visiting inside. If it goes to green, then obviously we're good to go with indoor testing. More to come on that, but those are some of the things that they talked about today. And I'll go over all that with everybody as we get closer to that. We plan on being ready to go live here early October to be able to do indoor visits so we can accommodate that. Any questions about that? I know that was a quick down and dirty, but that's the general gist. Okay. Guys, in terms of the workplace, and this is something that came up to me from some people that wanted me to speak to this about having you all know that the right way to handle situations when you're in the trenches working is to make sure that if you know that you have an issue with someone, that you have a conversation with someone who can help you resolve the issue. Not to have a conversation horizontally with someone next to you to say, boy, Dan's a terrible boss and I don't like, and that's a bad example because I'm like ED. But boy, Jane, I don't like Jane. Is there anyone? No one works here named Jane, right? Excellent.
No, I have
Oh,
a
there is a
Jane.
Jane.
I have a Jane.
Kate, Sally, Tim.
Just use Sarah, Jesus.
There you go. Sarah
with an A at the end, just no H.
With an H at the end.
Sarah, I can't stand working with Sarah.
No, I'm
She's all
saying
these
with an
things,
A.
and I can't stand being by her. Having that conversation, or Sarah's an unfair boss. She makes me do all this stuff that isn't right. Having that conversation horizontally with a colleague may feel good, but it doesn't resolve the issue. If you have an issue, you need to have a vertical conversation with someone who can handle that issue. Know that in anything that comes up, if there's an issue within your department you want to talk about, if you don't feel comfortable going to your immediate supervisor, which should be your first point of contact for whatever reason, because the issue is sensitive or involves them, you can go to anyone on the resource team to have that conversation and say, how do I handle this? Who should I speak to about this? Or you can come directly to Greg or I, either individually or corporately. You can come to my office, you can go to Greg's office and have a closed door private conversation anytime we're in the building. Between Greg and I, we are here almost 7 days a week between the two of us, and certainly during business hours, often before and often after. So take some time, find one of us and have that conversation with someone who can actually help empower you to find a solution to the problem and not just talk about the problem as a problem horizontally, but vertically, all right? All right, COVID-19. A lot of folks have had to take time off because of COVID-19. A lot of folks have not gone on vacations because of COVID-19, because Dan stood up at meetings and said, I would not advise you to go on a vacation this week to Florida because Florida's a hot spot, or whatever the situation has been in the last 6 months. I've definitely said, guys, please try to keep your contact down, keep yourself safe. Keeping yourself safe keeps our residents safe. But a lot of people have had to forego time with their families. And I will tell you that in normal circumstances, I'm a very firm believer in using your paid time off. I want you to have the time with your families. I want you to have time away from work so you can have time to clear your head. But because of COVID-19, we've decided this year we will not reset your bank at the end of the year. You will be able to carry over time you haven't used for this year, so that you're not penalized for doing the right thing, okay? And that's something that we talked about a couple of times. So in other words, if you have time left over, you will be able to roll it over to next year. You won't be penalized for not using it. Although please use it next year, because I do think you should use it.
I want us to add that if you don't know how much time you have or you're not seeing it on Paylocity, just
Have a conversation with the
have a
manager.
conversation.
Right.
Yeah, we can kind of
We can help you there.
help you out.
We still want to use Paylocity to its full advantage. And I know we're still working on that, but just remember, as you're putting things in Paylocity, that should be where you go to enter your requests for time off and those sorts of things. If you need help, let us know. But Paylocity needs to be, is becoming our primary place to go to for requests for time off and monitoring time. All right. Thank you to everyone who went through Blue Willow training this week. It's been a long process. We are very, very close to going live with Blue Willow. We will be doing additional training with Blue Willow. And when I say additional training, I don't mean sitting in front of a PowerPoint presentation learning conceptually about the things it can do. I mean actually with a phone in your hand, responding to call lights together and doing some scenario training. I think that will be very helpful to you all to really know how to use it and how it will impact your life. As soon as we can do that, even by the end of this week, we may be doing that as a team because we will be trying to go live with this thing very, very, very soon. Maybe as early as the end of the week, we're going to try to be ready to go live. We're pushing Phillips to get us to that place that we can decide to go live. Now, there's lots of work to be done behind the scenes. So be patient with us and know that that's coming. Tabitha, do you want to jump in on that? Go ahead.
Starting tomorrow, when you come into work, when you do like the check-in for your temperatures and all that jazz at the front desk, we are going to have a roster, and I have to have your personal email wrote down legibly so that I can understand it to type it into the system to get you access for Blue Willow. Like, we thought we were going to be able to just use one, and that is not the case at all. So we'll have a roster there at the front desk. By Friday, I have to have an email address put down for everybody.
It's
So,
primarily
and if
for
you don't have an
recovery,
email
right? Is it primarily for recovery of
Yeah,
password? I missed that and I apologize.
that's okay. So that's the only way we can push you your password to get you activated into the system. So it has to be a personal email. If you don't have email, come see me.
You can help
get
them
you
set
on
up a
Yahoo,
Gmail.
Gmail,
Yeah.
something of that sort. We can get you set up if you don't
Those are
have
free.
one. But we have to have it before we can go anywhere.
So
If you haven't met this young lady, Dan's rude.
I should just sit down. You're right. Like, that's been the first thing I did. Go ahead,
This
Sarah.
is Tabitha, she's our nurse liaison. Her office is in my office in Casey, so all three of us are in there. So if you need her, questions, that's where she'll be.
That's where we're social distancing the most in the building, isn't that office?
Mind your business. Sorry.
Well, I appreciate everyone's hard work. Tabitha, as you all got to meet Tabitha because she and I were swabbing
Swabs up her
every
nose.
single
That's the first
employee's
impression.
nose. So,
Yeah,
um,
I'm always mean.
but Tabitha will be doing many things around our building, including all pre-admission assessments. And she's a very talented registered nurse and very experienced. She will also be helping us support our nursing staff in a lot of ways. So we're glad she's here. Thank you for being here. Spend some more time with Tabitha before the end of the week and give her your email
But
address.
a lot of time with Tabitha.
I'm not going to go too much more into Blue Willow, except to say that it is coming, it's going live, and we are working very hard behind the scenes to get it operational as quickly as we can. Okay. Where's my thing? I don't know if I got it. So something that I think is very important for us to mention to the whole team is that one of the values that I hold dear and many of our team hold dear is that you have the right to vote. And that is very important. I don't have time to tell you why and how that is so important and why it's so important. I can tell you that there are fathers and husbands and brothers and cousins of people that work here at Kemper House that are currently fighting for your right to vote. Greg served his country in the Air Force fighting for your right to be able to have a vote. So please use that right. Now, if you don't know if you're registered to vote, I can help you with that. I have a QR that they use in the hospital to help people while they're waiting to get registered to vote. And I have that I can come by my office and I can help you register to vote. I don't want anyone in this company to use this job as an excuse not to vote. To the place that I will put you on the Kemper bus and drive you to a polling station if I have to. And I'm totally serious about that because a lot of people have given everything for you to have those rights. So please don't let work be a reason not to do it. Make a plan to vote. And if you need help, I can help you. We will help you. If you need to get scheduled in a certain way so you can vote, we will help you do that. But please don't think that I don't want you to
And I think
say be a part of the voting process. That's not true. We will help you do that, but you have to speak up and say, I need help with this. If you do, we will help you. I will help you because it means a lot to me. So I will help you do that, okay? I think, all right, if you have any questions, come see me and I'll be happy to talk to you more about it.
And they can also order absentee ballots and
Yep.
trying to do that now.
And now is the time to do that. If you're unsure about that, again, come see me and you can use your phone to get your QR and find out how to do that if you're registered and all that stuff. Whew.
requests, and we're just sending them to everybody.
If you want to not be exposed, if you want to minimize your COVID risk, voting by mail is a great way to do it.
We're seeing website, we just download the application.
So, there you go.
When I catch it, so I'm gonna go to the polling station.
Yeah, I always,
You.
don't worry about, yeah. Just run, yeah, if you don't want to wait in line, just go up coughing and you'll get straight to the front of the line.
Better
Um,
be jail.
So if you guys have things you need done, one of the things that I've noticed when I've been rounding the building is, I do know we have residents who things can break around the building. And sometimes in the moment, it's so easy to say something's broken, just take it and set it in a closet, close the door, and that's the end of the response plan to it. There are ways to let people know in the building if something's broken and needs attention. I know for sure that in Olentangy and in Colonial, there are clipboards, right, Bob, to do work orders? I don't know that down here, all three. So if you need something fixed, don't just say, don't just push it aside and say, that's the end of my responsibility. If you see something broken or needs attention, you go to a nurse's station, ask the nurse or someone who's in there where the clipboard is, and you can put in a work order for Bob then to look at, review, and put on his list. So every nurse's station has a place for all of us to go to put down things that are broken. Please don't just push it aside and say, I don't want to deal with that. When you get a chance that you can, get to that list, write it down so we can address it. We should not have things breaking around here. This is not the kind of place that we want to see over time lose its specialness in terms of how we decorate and keep it up just because things get pushed and broken and shoved. We want to fix those things. It's our intention to fix those things. So please take upon yourself to do your part to let us know when something's broken so we can get it fixed.
And
Anything else on that? Yes, sir.
I will say that once you put it on the clipboard, that doesn't mean your responsibility of making sure that got taken care of is over.
What's the next part after that?
Just to follow up and make sure that it got taken care of.
So if you say, this thing is broken, let's say someone broke the piano. Piano's a bad example, but Bob's not the best at fixing pianos. But whatever it is, you see something
Bob will
broken.
not take responsibility of the piano.
That's right. But Bob's point is well taken. It's not our intention to not do something. So if you see it broken and you come back a month later and you still see it, you need to communicate that, check the board, make sure it's still there, reach out so that it's not just being left into perpetuity, not being attended. It's not our intention to not fix things. So let us know if you see something that's not being addressed and we will fix it.
Dan, I had a good question today.
Yes, ma'am.
Just kidding. Knickknacks. A knickknack that they had to move away from a resident because they just kept gravitating towards it. They don't know where else to put it, in a different spot maybe. We can still have it in the neighborhood. What should we do with knickknacks?
All right.
I can answer that.
Yeah, go ahead.
Yeah.
So I am the knick-knack police, and this place looks atrocious, to be quite honest with you. I'm getting ready to do sort of a walkthrough with the leadership team to look at how things look now and how they should look. So I've done that kind of work for 20 years, and it's very easy to get very sterile and institutional looking as you start taking knickknacks out of communities and hiding them because a resident gravitates towards them. If it's not going to damage anything and the resident wants to take it to their room every single day, just please go get it, bring it back out. When you're walking through, think of your own home and how you have things decorated. And that's how we want it to look. And that's how it feels like home as we start stripping things down, we start feeling very institutional. And I'd rather us move furniture. If we move furniture out from where it belongs, we move furniture back in when we're done watching TV or doing what have you. I walk through this building and it just crushes my heart when I see a space that hasn't been arranged back how it was intended. And so I'm going to actually do some education on it. It's an important thing to Dawn and I that this building continues to look like it needs to look and feel like home, not a clinical environment. And part of that is a pain in the butt because residents are going to mess with knickknacks. That's what they do. And they might like this plant and want to take it to their room. That's okay. We might sweep through once a month, grab stuff from residents' room, redecorate that they've taken, but just know it's something that will constantly battle, but that's okay. As long as it's not putting somebody in danger, that's one thing. If it's not, and it's just a pain in the butt to upkeep, so be it. It's a pain in the butt to upkeep. But we want to go through with a discerning eye and go, you know what? We have this beautiful table now with nothing on it. That is not where we want to be, because that's what every other place would do. And we're not that. So, and we're going to get into more detail on that.
If you find something that is unsafe and you need to remove from the situation temporarily, you can always go to the nurse's station, ask the nurse what to do. The nurse can decide, let's put it in here, let's put it in the closet, or let's do something with it temporarily. If you feel like, I don't know what to do with this, you can always go to the nurse for guidance.
Yeah,
The
but
nurse
the
should
wellness
help you.
station is not the storage closet.
No, I agree. But if you find that yourself in a situation
Now
where you,
it's time to sort of.
where you don't know what to do with something, I would always encourage you to go to the nurse and say, I don't know what to do with this, and let the nurse help you problem solve that, because that's what, our nurse, that's what I would recommend to you do. Go to the nurse and say, I don't know what to do with this thing, and let them help you figure that out.
And the nurse will send you to them.
Yep, that's fine too. If you can't handle it, I will be happy to do it. Now, the light box cleaning. When you come in the building, I want you to know that it's been very hard for us to keep up all the towels and alcohol preps that it's taken for us to wipe down our phone and our badges and our keys. But as you all know, if COVID comes in the building, it's likely going to come in on a phone or a set of keys, and then you touch it and you touch something else, and suddenly it's off to the races. Now, in the front of the building, in order to fix that problem, I purchased 2 light boxes, ultraviolet light boxes. As you come in, right after you come past the time clock, they're just sitting there. You just open the lid, you put your phone, your keys, your badge, whatever things you have that are hard that could carry virus, close it, push the button, and it takes 2 minutes to clean. So what I would recommend you doing is to come in, put your stuff in, push the button after you do your hands and feet, and then clock in, go find out where your shift's going to be that day. Maybe go, if you have to run to the restroom up front, whatever, and then grab your things and off you go with your day. There are 2 of them, so hopefully that will minimize the amount of having to wait in line. You can just, if one's being used, throw your stuff in the other one, or come back up, or throughout your shift. If you come through that space in the day and you want to like throw your phone in there again, that's great. But that's what that's for. It's so that you don't have to, we don't have to continually find more Claus and Santa Claus and alcohol preps, because you all know that we only were able to manage that system about half the time to keep something really there consistently. This way, it's always there, it's always ready, and it'll help keep you, it'll help keep the building safer to do that.
And the top of it's a charger.
Oh yeah, if you
And the
set your
top
phone
of
on
it's
top
charger.
of it.
And it can do aromatherapy too.
And it can, yep.
It does everything. It does everything. Okay. It does aromatherapy. True story. It does. It also can do aromatherapy. Okay. Outdoor visits. From now on, I know families call in all hours of the day asking about visits, but there have been lots of challenges with all of us trying to manage that together in terms of scheduling it. So from now on, if someone calls and says, I'd like to schedule an appointment, we'd say, our scheduler is Colleen. She's our executive assistant for the building, and she's out right now. I'm going to take your information, and Colleen will reach out to you and schedule your visit. So I don't want us to go up and scratch people's name out and write new names in, because all of us doing that together has just been too much. So the message is simply, Colleen is our scheduler, and she will get back to you. Take the message as you normally would. Say, who's calling? Thank you very much. I will have Colleen get back to them. You can direct them to the ambassador email, or you can tell them to call into our main line during business hours, and Colleen will schedule them. And that's true of all of us, of Greg, of me, of everyone else who works at the desk. That's going to be Colleen's to run. That way we can minimize it. I'm sure there will still be families showing up 2 at a time, or things will still happen. But if we get it to one person to control, it will help minimize the chance that, you told someone they called off, but you didn't write it down, and then you forgot to put it here, and it went there, and suddenly there's 4 families showing up for visits. So that's our plan moving forward. Real quick, those of us that smoke, not me, but those of you who smoke, behind the Kemper house, between the dumpster, the wall where the dumpster is, and the second wall where the train is, there's a space there of probably 6 or 8 feet, and it's probably 12 or so feet long. For now, that's where we're going to say that is our primary spot to smoke during work hours. If it's inclement, of course, you have the option of going to your car, doing something like that. But our campus is supposed to be a non-smoking campus, and we have had our neighbors notice that we've had people smoking cigarettes in their lots and on their grass. There's a school and a dentist office and other things around the building. And I just want you to know, from a health perspective, if you find it more difficult to smoke, maybe don't smoke. That would be my suggestion as a nurse. So,
Amen.
yeah, I'm just saying, guys, COPD, if you have any idea about how that ends, you can talk to Tabitha and I. We can show you some pictures or talk to you about what that looks like in the ICU. It's not fun, not worth it. And it's expensive. Don't do it. This has been Dan's health moment from Nurse Dan. I want to talk or mention briefly for Danielle and Chelsea to talk about the walk to end Alzheimer's disease, and then we'll be able to transition into our quiz and announce our Employee of the Month.
All right, all you cool cats and kittens. So this month is the Walk to End Alzheimer's. Typically, if they gather in large areas and you walk together and celebrate, finding a cure for Alzheimer's disease. But given COVID, that is not happening. So it is a all virtual walk. We still have a team created. It's the Kemper Crew. So if you want to join our team and help raise funds for the Alzheimer's Association, the information is on here. And then we're also going to do the virtual walk together on the 27th of this month. So grab one of these if you would like to join us, or if you don't want to join the team and you just want to donate to somebody that already has, been a part of the team. But please consider donating or joining our team for the Walk to End Alzheimer's. Do you have anything, Danielle?
No, that's it. You don't have to walk this year, which is kind of cool. You can do really whatever you want. So if you would like to do a challenge for yourself and you want to do, 100 push-ups or jumping jacks, whatever, to try to make it a little bit funner. Obviously we don't have those limits of having just a walk. You can join, I think a group of people may walk from here on the 27th, but you're more than welcome to do it in your own home. They are going to have some online stuff as well. So our team link is actually on that page. So you can actually just go right to that. I realize it is a long, hairy link on there, and I apologize. But you can also go and just search for us on their website if you prefer to do it that way.
Kemper Crew with a K.
And two, I would like to have a small group of us or larger group do a walk through Worthington with our Kemper Crew shirts on, just as a visual representation of us caring and moving forward with trying to raise money and fight against Alzheimer and other dementias.
If
So
we have more than 10, we can do waves. Like we can do a first wave of 10 and then a second wave of 10, so we can keep it socially distant.
Yep.
Appropriate.
yeah,
We just do
so we can take as many as we
Yeah,
want.
if 30 people decide to do it, then we just have, 15, the first 15 minutes, the first 10, and the second 10, so we can all be.
And maybe we could make up little signs or something too as we're walking through.
Like take your family, put a couple of pictures on
Yep.
it.
Last year was a lot of fun. A lot
I'll
of
take
families,
200
people
though.
came. I mean, I think your daughter came, didn't she, Danielle? We had a lot of
Might
fun.
as well.
It was a good time. So I'm looking forward to next year because we start and stop like at the Huntington Stadium downtown. It's
It was fun last
a lot of fun. So hopefully this year we get back to that.
You raised your hand, Bob.
Do you want to do money?
Oh yeah, I'll do money.
All right, guys. Woo. I'm gonna go over here. So if you're in the room, this is time for our Kemper quiz, our monthly Kemper quiz. You guys if you want to see this go down right, you got to come to night shift. Night shift gets really rowdy for this thing.
Yes.
Yeah, you guys aren't nearly rowdy enough right now.
Just saying. All right. So first question.
They're just coming on.
Well, yeah,
Here's
it's all
just
enough.
finishing up all
So
day.
if you know the answer, just put your hand up and we'll watch for the first hand we see. Don't shout out the answer, just put your hand up.
He said,
When is the next staff meeting?
I
Right
was
there,
back there,
Tamia.
Tia.
October 21st.
Say it again, October 20 what? Yes, you're right.
Yes.
Good job. October 21st. So we'll see you all back here October 21st. Okay.
Or 11 o'clock tonight if you want to come join us.
All right, Caitlin, this one's for you. I don't think we told you about it. You ready? You can't answer this question. You can answer this question. I'm gonna try to, but especially this one. I'm gonna try to speak slowly and see if I can do it right. Name one of the Kemper Care Movement and Wellness classes put on, I won't say by Caitlin, I'll just say in general, because I do one too.
Yeah.
Yeah.
We accept that as an answer. Caitlin will accept that as an answer. Correct.
That's because I'm harassing everybody on Facebook.
Other acceptable answers would be intuitive movement, wellness walks, and of course the Run Walk Club.
Meditation.
Kemper Fitness. Is that the one I'm doing?
Yep.
Urban Zen. Mine's a circuit class. That's next week, 7:30 on Tuesday.
Different things.
Oh, yeah. Yeah. And then Friday, 4:30? No, Thursday at 4:30. So joint.
Check out the
come.
calendar outside of the fitness center.
Yeah.
The only thing we do have to nix for this month, and I'll send out a new calendar, is on Sundays, it's the Urban Zen. And right now, Beth May, who is through Capital City Hospice and doing her hours with us, has been told to not come into the building to do that. So we're gonna wait till October to do that. So just so you know, nothing on Sundays right now. Thank you. I think it's just their clinical hours, so just they don't want to.
It's the school that's.
It's the school that she's doing her.
Oh, the school's telling you. Okay.
Okay. Last question of our quiz. Who should you go to find out if you're registered to vote?
Maddie.
That's correct.
That is correct.
I don't have my lanyard on at all. So you'll need yourself and your smartphone. That's what you need to do. Bring your smartphone, and then you can take a picture of the QR, and we'll get you registered to vote. Okay. Now it's time for our staff member of the month. For October. Recently we had Vida, and then after Vida was Sarah Danso from Night Shift. So now we are going out of caregiving to a different department, and we are giving this month staff member of the month is Capri. Capri is fairly new to us, but he has been working. Very, very hard to keep our building clean and safe. He has been the one that stepped up to do the extra cleaning for COVID, is he not? Is he the one doing the rails? I know they're all doing it, but I feel like he's been doing rails and doorknobs and Oliver too. Yeah, Oliver you've seen out doing around the building too. You've seen Oliver out, but they both been working very hard.
Actually, it was a toss up between both of them.
It was, honestly.
Yeah, they were both working very hard. If you see Capri, congratulate him. And we can tell Oliver he's still in the running. He's still in the running. But thank you guys very much. I don't have anything else, but I will be here for a few minutes to answer questions. Thank you all for coming. I appreciate your time. Come back at 11 o'clock.
Who was that galaxy right there?
Hey, people on Zoom, don't go anywhere. We want to make sure we get your names down.
What I might not have is that galaxy.
Some of you guys are coming up as just like iPhone or Galaxy. So like there's one that says Galaxy S10e. Can you tell us who you are?
Michelle.
Oh, Michelle.
Wait, I think I have her.
Oh yeah. Let's see. Trying to figure out who's. Lena, are you in the building?
Who's nurse one then?
Who's nurse one?
Yes, hi.
I was on nurse one, and then I had to come over so that Sandra could get some food, so I switched over to my phone.
Oh, okay, I got you. You say you're here?
Yeah, I'm here.
You're in the building. Okay. Okay.
Hi, me and Don are in Olentangy.
Got you. Okay. I think we got everybody. All right.
Sandra.
Joe, thank you. Anybody have questions before I end this?
Are we doing our last survey?
Yes. Private dining room.
How many people are going to do it?
Private dining
and
room.
what the basic cost fee is, so then I can give you quotes, so you'll know. So I can give you, yes.